we get to our high flow devices. Here we're going to discuss the Venturi Mask, the Aerosol Mask, the face tent, and the high flow nasal cannula. So here is our first high flow device, a Venturi Mask. Now a Venturi Mask provides an accurate level of oxygenation as well as provides a range of oxygen from 24 to 60%. Now there are little adapters and each of them are color coded as shown in the image to the right, and each color provides a specific level of oxygen. They're going to indicate how much oxygen the patient is receiving, okay? So the blue adapter, this is going to provide 24% of oxygen, the white adapter, 28% of oxygen, the orange, 31, and so on. Next, we get to the aerosol mask. Now, this mask provides aerosol therapy, which consists of humidification and med administration. So this humidification that we just discussed also makes it easier to liquefy secretions for expectoration, and it also humidifies the respiratory tract. Now the aerosol mask also relieves bronchospasms and edema that may be causing any airway compromise. Next is the face tent, which is for patients who have suffered from face trauma, burns, or upper airway surgery. It also provides oxygen therapy without necessarily touching the face, as you can see in the image. The reason we want to add humidification or mist is to not cause any rhinitis or sinusitis to the patients. If we're just giving oxygen, it's pretty much going to dry out the nasal cavity, going to cause epistaxis, which is nosebleed. We don't want that. So we're going to add humidification or mist. And here's our last high flow device, which is the high flow nasal cannula. Now, this form of oxygen therapy humidifies and compresses air, as well as delivers oxygen up to 60 liters per minute. So it also is going to reduce anatomical dead space in the lungs, which is the spaces that don't get any oxygen or participate in any gas exchange, hence the name dead space, they're just there. So the high flow nasal cannula is going to fill up those dead spaces, providing more oxygen to the patient that they can use at their disposal, or the body can use at its disposal. Now, besides reducing anatomical dead space, it also helps with the PEEP, which is the positive end expiratory pressure that we naturally have. Usually a preset PEEP already exists in our lungs, and the PEEP serves to keep our lungs open, preventing it from collapsing during expiration. The PEEP pretty much serves as a little pressure within the lungs. That way, at the end of a full expiration, there's still a little pressure within that lung, keeping it open. Now, high flow nasal cannulas help even more by keeping our lungs open by adding extra PEEP.